Welcome back. We are continuing our discussion on high blood pressure with Dr. Sharon Hecker. Nice to have you back with us. So hypertension can cause serious damage to our bodies. Let's talk about the arteries and what unchecked high blood pressure can do to them.
Well, first I'm just going to describe a little bit about what kinds of things unchecked high blood pressure can lead to, and then I'm going to explain a little bit about why. Okay. First of all, unchecked high blood pressure causes all kinds of problems. It can lead to strokes, it can lead to dementia, it can lead to heart attacks, as well as congestive heart failure without having heart attacks. It can lead to atrial fibrillation, peripheral vascular disease, erectile dysfunction, and kidney disease. So there's all kinds of things that it does. And why does it do this? You think, okay, well, how bad really could it be? I feel good, I feel fine. The problem is the high blood pressure is kind of like spring runoff in Montana. If our arteries are the rivers, and all of a sudden we have all this flow down the rivers, and those are our arteries, you can imagine debris gets distributed here and there. Banks erode. In fact, the erosion is actually a problem within your blood vessels. If the blood vessel is, or if the blood pressure is too high for too long, you can actually have ballooning of your arteries, and aneurysms can form, and those can rupture and kill you. So we just don't want that uncontrolled flow of blood to go throughout the body. It needs to be restrained the way the rivers look maybe in July or August instead of May or June.
So I can imagine the heart is impacted by all this. So can you talk about the damage specifically to our hearts?
Right, yes, I can. What happens when the heart has to pump against such a high pressure is that it gets thick. It gets muscle bound, just like a bodybuilder would get, like Arnold Schwarzenegger. And when the heart gets muscle bound like that, the blood tends to back up into the lungs, and we call that congestive heart failure. Lowering the blood pressure can actually cause regression of the stiff heart muscle and help the heart to behave more normally. Additionally, the blood vessels that supply blood to the heart, those also can be damaged by the effects of high blood pressure. Again, forming blockages or aneurysms, and lowering the blood pressure will then help the body to heal itself.
So what about our brains and hypertension?
Yeah, the very same thing. This high pressure head going to our brain actually makes us feel good. So people lots of times don't like to take the blood pressure medicine because having high blood pressure will make your brain feel energetic and happy. And when we give you medicine to lower the blood pressure, you might feel tired or sleepy for a while as your brain adjusts. Unfortunately, if we let the pressure stay high for a long period of time, you'll start having problems. Again, strokes are a big problem. One thing that is very insidious that people don't realize, I think, is that you can have small, almost microscopic strokes over long periods of time that end up leading to dementia.
And so would we not know that these little strokes, small strokes, are happening?
You might not know until you're fully demented.
Oh my goodness. So what about things that are external, like cigarette smoking? Can you talk to us about that?
Yeah, cigarette smoking is interesting. It doesn't exactly increase your blood pressure by itself, but what it does do is the effects of cigarette smoking are additive to the high blood pressure. So it's an extra stress on your already fragile arteries if you have high blood pressure.
So what about other impacts of hypertension? Can you talk about some of those that we might not even think about? Like fainting, could you faint? Could you talk about some of those issues?
Yeah, sometimes your blood pressure can get so high and become so uncontrolled that you can actually suffer from what's called cerebral edema. That is, your brain swells in response to the blood pressure. That's an extreme circumstance, and we don't see it very often, but it can happen. And that might show up as blurred vision, headaches, or even loss of consciousness.
So if someone has high blood pressure, they should be monitoring their blood pressure frequently. So what about home monitoring units?
Home monitoring units are great, but I will give a few caveats to that. The first one is that all blood pressure monitoring systems, with the exception of the mercury manometers, tend to drift with time. And so some of the brands, and you can't even tell based on the expense, a cheap blood pressure monitor might be just as good as an expensive one. But they do tend to drift. And so we recommend that a person get their blood pressure monitor at home checked against an office monitor quarterly. So every 3 to 4 months, you should have it checked to make sure that the readings are similar. Additionally, I would also caution people against rechecking their blood pressure frequently. We know that if you recheck your blood pressure, each time you check it, it will go up in a short period of time. So if every 5 minutes you're checking your blood pressure, it'll go up, and it'll go up, and it'll go up. And you can actually cause yourself to have a problem. So if you're gonna check it at home, just check it maybe once in the morning and once in the evening, or even just 2 or 3 times a week.
And then go to your physician, or when you go to your physician, take that monitoring device with you so it can be checked there.
Exactly.
That's great. Okay. I had no idea that high blood pressure could cause so many issues. Stay tuned to learn what you can do to control hypertension if you have it. We'll be right back.